Okay, so in this video, I'm going to talk a little bit about interleaving. So there's kind of two different contrasting approaches when we review topics. We can usually use more of a blocking approach, which is where we focus on a single topic or a problem type or something like that for an extended period of time. We kind of focus. Then we move to the next topic, focus on that topic. Then we move to the next topic, focus on that topic. So we kind of review materials or look at different problem types or things like that in different blocks, hence the term blocking, or chunks, right? So this on the top here to the right kind of shows what blocking would look like if we were trying to learn three different concepts, right? A, B, and C, right? We might repeatedly review concept A, or maybe it's problem type A. We would do a bunch of those problem types. Then we would move to a different problem type. And then finally, we'd move to the third problem type, right? You're blocking the order in which you review the problems, right? Or the different types of problems or different concepts, right? Interleaving is more about mixing up the topics or the problem types you're trying to learn, right? So this would be, hey, we're going to start with problem type A or topic A, then we're going to move to B, then we would go to C, then we'd revert back to A, then B again, then C, then A, B, C, right? So it's kind of a little bit more random, appears haphazard approach to reviewing our materials. Now, blocking is going to feel more effective. It's one of those things that when we're studying, it feels more natural, I think, to kind of take a blocking approach. Focus on one problem type, focus on one subtopic, feel like you get that down, and then move to the next, focus on that, feel like you get that down, move to the next. But interleaving has several key advantages for our learning, right? It's very helpful when we can kind of mix up these different topics or maybe problem sets that we're trying to learn, because it helps us identify the distinguishing features of the different topics and the different problem types, but also see how they overlap. So I always think this is a nice way to start to see the bigger picture of not just viewing topics or problem types as isolated pieces that you kind of have to learn and then you move to the next, but being able to kind of mix and match these different things to see how they're connected, but also start to learn how they differ, right? So let's look into the literature a little bit. This was a study by Nate Cornell and Robert Bork in 2008. So they wanted to compare this kind of blocked approach to an interleaving approach. So they did a little experiment where they examined college students' abilities to recognize paintings from different artists. So what they did is they showed students paintings from a collection of artists, right? And some of the students viewed the paintings in a blocked manner. So they would, say this is paintings from this artist. Here's maybe, 6 of his painting or her paintings, right? Then they would say, now move to the next artist. Here's 6 of their paintings. Then they'd move to the next artist. Here's a collection of their paintings, right? So it was blocked, right? You saw painter A, B, and C, right? Other students reviewed the different painters in more of an interleave pattern. So they would see a painting, it would be from, painter A, then they would see another painting and it would be from painter B, and then C, and then they'd see another one from A. So it's, again, they kind of mixed and matched the order in which they saw the paintings from the different artists. So then what they did is, after the students had a chance to review a collection of paintings from the different artists, they gave the students a new collection of paintings from the same artist and asked, hey, can you identify which of the artists these paintings came from, right? So the idea was, could they pick up on some of the, the key features or the style of these different artists? And what they expected was that the blocked pattern, the students who reviewed the paintings in more of a blocked pattern, were going to be better at kind of picking out the different, who painted what at the end, because they thought, repeatedly reviewing these same paintings from this specific artist will help the students say, oh yes, I can kind of, in my mind, I can see the style of this artist. But actually what they found was exactly opposite. The students that kind of saw the paintings in an interleave manner, where they might see it from one painter and then another painting from another painter and then mix it with a third painter and then go back to the first painter, you get the idea, kind of a more interleave pattern. They actually, when you look at the figure on the right, they actually correctly identified 61% of the new paintings they were shown. Whereas the students who reviewed paintings in a block manner only correctly identified about 35%, right? So, seeing the different paintings from the different artists in more of a random order or more of an interleave pattern appeared to help the students identify the key kind of style of the different artists. And one thing I note there behind or underneath the figure is that they also asked the students what they thought they would perform better in, which condition. Did they think they would do better when they viewed paintings in an interleave manner, or did they expect to do better when they viewed them in a block? And this was another case where the students actually thought they were going to do better when they viewed the paintings in blocks, but they actually ended up performing better when they saw them in an interleave pattern. And this is another one of those cases where we get tricked, right? We think one thing that's better for our learning because it feels more natural or maybe is allowing us to be more successful in the short term actually turns out to be less effective for our learning, right? So this is another one of those examples, right, where we get tricked. So to now move to, obviously, you know, most of you probably won't spend a lot of your time reviewing paintings and differentiating between different types of artists. Not to say that that wouldn't be fun. Let's look at another article that's more in the medical, related to the medical field. So this was a study by Anna Rosenstein. So what they did is, her and her team did, they looked at medical residents' ability to differentiate, you know, concerning patterns on X-ray images. So they would have, you know, images, radiographic images of, you know, patients without any kind of you know, condition. They would have patients with pneumonia, congestive heart failure, emphysema. They would have all these different, you know, presentations, clinical presentations showing up on these X-rays. And they had some of the students view the patterns or the different X-rays in more of a blocked pattern. So they would see a collection of, you know, normal images or scans, X-rays, and then they'd see, you know, a block of scan or X-rays of patients with pneumonia. Then they'd see a block of X-rays for patients with congestive heart failure. You get the idea. Whereas other students, it was kind of mixed up, right? They may say, here's a normal X-ray, here's an X-ray with pneumonia, here's congestive heart failure, here's another person with pneumonia. So, you know, they took that more interleaved approach. And then what they did is they said, after they had a chance to review the X-rays, the example X-rays, they were provided, after a short break, they were provided with those same set of X-rays, and they were asked to identify, you know, what pathology was kind of present. You know, they had to identify, is this pneumonia, is this congestive heart failure, things like that. And then they also gave them a new set of X-rays that they hadn't seen at all, right? So they wanted to know, not only can you kind of recall the X-rays, the pattern that you've already reviewed, when you're given new X-rays, can you actually pick up on what the differences are? Probably closer to what a physician's going to have to do when they're actually practicing, right? So when they look at the results, they're kind of depicted here on the right. You know, the dark gray is the performance, the number of images that were correctly identified, or the number of X-rays that were correctly classified, you could think of it as. The dark gray is the blocked pattern, and the interleave pattern is the lighter gray. And you can see that for the previously viewed images, the students performed much better when they viewed the images in a more interleaved manner, right? They didn't just see, you know, blocks of X-rays from people with pneumonia, blocks of X-rays from people with congestive heart failure. They were kind of mixed and matched, right? So they saw one, and then they may see another pathology, then they may see another pathology, get the idea. And the same trend they found when they analyzed the new images. You can see on the right, it's covered up a little bit by my video, but over here you can see that the students correctly identified, the medical students correctly identified the right pathology 53% of the time when they viewed the images or the X-rays in an interleave manner, but only 40% of the time when they had reviewed the X-rays in a blocked manner, right? So what this is showing us is really the same thing that Cornell and Bjork had found when they asked students to review the different artists' paintings. As you know, it appeared that folks are better able to identify the distinguishing features when they're, you know, reviewing images and things like that, when they view them in more of an interleaved manner versus when they view them in more of a blocked manner, right? So I know the two examples I've kind of highlighted here have really focused on visual recognition, right? Can we identify the distinguishing key features of a certain artist from other artists when reviewing paintings? Can we identify or classify the correct pathology when we're looking at an X-ray? But actually, interleaving has been found to be helpful for learning a wide range of concepts and procedural skills even, right? So it's not just, you know, visual recognition. It can be, you know, learning concepts. It can be learning to do math, different types of math problems, procedure skills, learning different clinical techniques and stuff like that. So it's actually effective for more than just kind of that visual recognition, right? Now, interleaving also, this is just kind of an interesting note, is also more effective than blocking when we look at motor learning, so learning some type of motor skill, right? And there's some interesting research in this area. So, I kind of put a golfer on the right because I'm not a very good golfer, but I hope to be better one day. But, if you use kind of a block approach, if you're working on your golf swing, you may go to the driving range, or you may go to the range, and you may say, all right, I'm going to work on my chipping for a while, maybe an hour, and then I'm going to go work on my driving for an hour, and then I'm going to finish with putting, right? You're kind of blocking the different, types of shots, right? Whereas if you use more of an interleaving approach, you would say, well, I'm going to work on putting for a little bit, and then I'm going to move on to driving, and then maybe I'll do some chipping, and then maybe I'll go back and putt a little bit, then I might drive, and I might chip, right? And kind of mix up the order. Now you think like that would be kind of seem like an odd way to approach things, but a lot of the motor learning literature kind of aligns with what we know about, cognitive learning, that kind of mix matching the order in which we're practicing, whether that's practicing as like studying for a test or practicing learning to, not, fix my slice, whatever that means in my golf shot. It's a lot of times more effective when we kind of mix and match the different types of problems or the different types of motor skills we're trying to learn and things like that. So it's not entirely clear why interleaving tends to be more effective, but there are some thoughts as to why, right? So here's some kind of ideas. One is it can help us to identify the distinguishing features of different concepts or problem types. So you could probably imagine, with the X-ray example I gave you, when we interleave, we can say, well, every chance we review a new image, it's a chance for us to basically see another image and start to basically create a mental framework to say, when I see these certain characteristics, I'm going to classify it this way. Then the next image, it says, well, I don't see those characteristics, so I'm going to classify it this way. So it's a nice way to kind of identify the distinguishing features. Same thing when we review different things like problem types, right? There's a lot of research on interleaving in teaching mathematics at all different levels, right? Like starting with young kids, high school age, even up to college age. And, conventionally kids would be, or, people trying to learn math, they would be given one problem type. You might be given a worksheet with all, if you're a young kid learning, multiplication, and you would just kind of go through and you'd do your problem set and you'd hand it in and you'd get a gold star, or maybe you wouldn't get a gold star. And then the next day you may learn about, you may have homework about division, right? And you get a worksheet about division. And now what they're finding is, mixing up the order of the problems is probably more beneficial. So you'd get a worksheet and yeah, it would have some maybe multiplication problems, some division problems, other types of problems, so that every time you do a problem, you have to say, okay, how is this approach different from the last question, right? It stops you from that kind of plug and chug mentality to be like, I just did this type of problem, so really all I need to do is put new numbers in and kind of move through the same process. So again, it's going to push us to basically have to step back a little bit and start to think about what are the distinguishing features of this problem that are either similar or different from the last problem I just did, right? Same thing we thought with the images. What are the distinguishing features I identify in this image that wasn't present when I reviewed the last image, right? Interleaving also involves more retrieval and greater mental effort, right? So you think of, if to go back to the math example, if you had one set or type of math problem that you were trying to do with a worksheet, basically what you'd be able to do is say, okay, I'm going to bring all that information forward in my working memory so it's available to me, and I'm just going to, like I said, kind of plug and chug through these problems. Well, if you have different problem sets, every time you get to a new problem, you're going to have to go through that process of pulling all the relevant information forward from memory, do the problem, and then kind of go for the next problem. You kind of have to start over and pull new information forward into your working memory. So again, it's going to kind of naturally blend in some of that retrieval, and it's going to involve a lot more great mental effort, right? You'll notice that if you kind of play around with interleaving versus blocking, blocking is going to feel more natural and it's going to feel more easier, right? Because once you kind of understand the rules for a certain problem type and you're just doing the same type of problems over and over again, kind of the mental work is done, right? Whereas if you're jumping between different problem types or you're trying to review images of different pathologies, every time, every new opportunity to do a new problem or look at a new image is going to require that original amount of cognitive effort. You're going to have to struggle through pulling information from memory, looking at the distinguishing features, those kind of things. So again, it ends up being a desirable difficulty, something that's hard in the moment, but actually tends to promote our learning, right? So it would go back to Bjork's idea of kind of a desirable difficulty. So talking about how to kind of build interleaving into your routine, right? Because it's probably less intuitive of how you might make this work when you're studying. Well, one thing I like to do is mix up subtopics when I'm reviewing. So imagine you're studying for a physiology exam, and a lot of times when we teach physiology courses, it's kind of blocked into different content areas organized by the systems of the body, right? It must be the muscular system, the skeletal system, you know, all the different systems of the body, right? And you'll go through different units in the course, and they'll say, okay, this is this system, then we're going to move to this system, then we're going to do this system. And I notice a lot of times, like if students studying for a midterm or for a final, they'll basically study in the same order the information was presented, and they'll study it in kind of blocks. They'll say, I'm focused on this system, right? I'm not, if I'm studying the skeletal system, I'm not really concerned about the respiratory system at this point or something like that, right? So again, that would be more of a blocked approach. You study a certain topic, you get done with that topic, you feel confident in it, and then you move to the next topic, right? Taking more of an interleaved approach would be, all right, I'm going to study some of this topic, but I'm also going to mix in concepts from another system of the body, and I'm also going to mix in another concepts from another system of the body, so that you can start to see the bigger picture of how the different systems of the body kind of have to organize and interact with each other, and start to understand some of the, even though they're different systems, how sometimes they have some similarities, right? So it can be a really effective way to study. A lot of times I've had students where their instructor will list a bunch of objectives that they expect them to be able to know going into the exam, right? And again, usually those objectives are organized by the modules, which are organized by body systems. And again, I'll see students go through those objectives, which is great, but they'll go through them kind of one by one, and they'll say, I'm going to start with the respiratory system, and I'm going to start with the cardiovascular system, whatever it may be, and I'm going to work through those topics, or those objectives, right? And make sure I can answer questions related to those, and I understand what the instructor is asking for. But if you took a more interleaved approach, you would maybe pick and mix and match those different objectives related to the different body systems. Because what it would do is every time you review a new objective and you test yourself on it, you would have to say, what system am I talking about, right? And then you would have to say, all right, I got to pull all that information mentally forward from that topic area. And then the next, the next objective you reviewed, you would say, okay, now what system am I talking about? I've got to pull that other information forward. So, it can be a effective way to kind of mix and match some of this different content that's related, but as different subtopics and stuff like that. The other point is blend typical and atypical patterns when you're learning to differentiate between clinical presentations. So like an example I like to use is with like EKGs, right? We probably all, need to learn, what a typical EKG looks at some point, and then maybe some, concerning EMG or EKG patterns and stuff like that. And one way you could do it is more of a block pattern. Hey, maybe you have your instructor gives you a big set of, typical looking EMG or EKGs. You look at all the typical patterns, then they give you one of certain condition or a certain pattern, you review those. But what you'd probably be more effective with is randomizing the order of them, looking at typical and then maybe one with some kind of atypical pattern, and then another typical, and then another typical, and then an atypical, and quiz yourself that way, because then you're going to be able to say, all right, this is the pattern that these are the key characteristics that differentiate between these different types of clinical presentations, in this case with EKGs, right? I've had the same conversation with students that were learning to kind of do skin screenings, right, for concerning skin lesions, right? They would look at a bunch of moles that were non-cancerous, and then they would kind of move into ones that were maybe concerning a little bit. And I'm like, what you probably want to do is mix up the order of those, right? Because you're like, you want to be able to say every once in a while when you're looking at some of these concerning moles for different reasons or whatever you're looking at, you want to mix in a normal one so you can start to say, hey, this one isn't concerning and these are the characteristics. This is different than the one I just reviewed, right? You probably don't want to just, review a bunch that are the same presentation and then compare those to ones you reviewed that were non-cancerous. You want to mix them up, right? That'll help you identify the distinguishing key features that help to differentiate the two. Same thing when you're working on different hands-on skills when you're practicing. I think as a student, when I was learning different practical skills, like, I'm a therapist, so, I'd learn different techniques for, restoring joint mobility or something like that. I would basically say, these are the techniques I'm going to work on. I'm going to work on this technique kind of until I get it down, and then I'm going to move to the next technique. And I would just practice. I'd find a partner, we'd work together. I was working on the foot, this certain technique. I would practice it. They would practice it. I'd go back and say, I want some more practice on it. Then they would practice. You get the idea, until we felt comfortable. A better approach would have probably been to say, here's a big list of different hands-on skills we know we need to practice. Let's randomly start to practice these. So sometimes I'm using this technique, and then the next time I practice, I try a different technique, and then it's a different technique. So it forces me to kind of switch things up a little bit, because that requires a couple things. One, I have to think about, every time I do the technique, I have to think about, what is my positioning? Where should I be positioned? How much force should I apply here? It's not like if I just kind of repeatedly practice the same skill. It's really, the mental work is done after the first repetition, right? Because I can keep trying to apply it and stuff like that, but all the mental work of figuring out where I need to stand, how I should position myself, how much force to apply is kind of done after the first rep. After that, I'm just kind of going through the motions a little bit. So again, there's a lot of benefit to just kind of mixing up the order of the topics you're studying, the order of maybe imaging or clinical presentations you're looking at, and even the ordering of the skills you're trying to learn, right? So a few additional considerations. I kind of talked about mixing up topics like in physiology, where you have the different systems and stuff like that. Interleaving tends to be most effective when the concepts or the topics you're looking at are at least somewhat related to each other, right? It probably wouldn't make sense, or it wouldn't really be that helpful to mix concepts from your anatomy class with a medical ethics class, right? Because they're not close enough or related really much at all, where you would be able to kind of say, well, I can see how there's some similarities here, but there's also some differences, right? They're so different that it doesn't, you wouldn't probably get much benefit from interleaving. The things should be somewhat related, so you can have to kind of work to figure out the distinguishing characteristics. The other thing is that interleaving, I think there's some evidence for this, it tends to be more effective once you have a general understanding of the main concepts or ideas. So sometimes when you're first learning a topic, it feels good to probably just focus on one topic at a time, and still do active recall and some of those other things we talked about. But interleaving tends to be a nice add-on as you get farther down the line. And it's like, yeah, I understand these topics in isolation, but I'm struggling to see how they might be related to each other, or to distinguish between the different systems and how they're similar and how they're different and those kinds of things. That's when I think once you have a general understanding, then it's good to kind of introduce some interleaving into your studying routines and things like that. So final thoughts here, interleaving is one of those things that it doesn't feel very natural when you try it, right? But I think it's worth building into your routine. It's one of those desirable difficulties. It's a thing that's going to feel hard in the moment, but actually is probably going to be effective for your learning, right? I think it might be particularly important for healthcare students or health profession students, just because, a big part of your job is being able to identify the characteristics or the signs or the symptoms, if you're thinking about a patient case, that differentiate, one scenario from another, right? So I just think of two patients coming to you, 90% overlap between the way they present, but it's that 10% difference that you need to be able to distinguish to say, well, this is just a pretty routine, or a pretty common condition that they've got, whereas this one's more concerning. They're 90% of the same, but it's the 10% difference that you need to be able to pick up. So I think that's where things like interleaving can help you see the bigger picture. And I would say here, feel free to get creative, right? I know in this video, I didn't give you a lot of guidance as far as this is exactly the way I'd use this technique, because I think there's room for, like I said, creativity, right, to build in some interleaving, especially once you feel like you have a pretty good grasp of the topic, it's a nice way to kind of push yourself to get that, the last few percentage points of knowledge mastery as you start to study for your exams and things like that.
If you enjoyed this content, be sure to like and subscribe to my YouTube channel, Learning That Lasts, and check out my book, Learning That Lasts, which is available on Amazon.